yeah, oh yeah, oh yeah. Love so long, love so strong.
Hey, it's me Kimberly, and this is my second coronavirus video. I am a medical doctor by profession. The first video I highlighted pertinent information about COVID-19 as it relates to Trinidad and Tobago, and in that video I went full doctor on them. But this video is going to be a bit more casual. Today, I have seen several a YouTube doctor, which I am not. I'm a real world doctor, not a YouTube doctor. I've seen several a YouTube doctor basically enslaved by coronavirus update after coronavirus update, and they might not mind, but I mind, for the very fact that this is an entertainment channel. So my purpose as an entertainer or a creative is to take your mind off of what's going on with the world, not put your mind back on it. So I'm just using this platform right now just to highlight some things that I think might be important mentioning, or some things that people asked me, or some things that need to be dispelled, misinformation, little tidbits. But this video is also going to be in two parts because it is talking so much. Like, talking so much makes a video so long. Anyway, it's gonna be in two parts, right? So I'll leave timestamps down below in the description box, as well as in a pinned comment below, so you'll be able to see where the different topics were discussed. And if you're not interested in watching the entire video, that's fine, you can just skip to that relevant time. So I will be going back to normal videos, but of course if there's something really noteworthy or prominent happens, and I'll cover it here. But for now, you can feel free to, you know, stay subscribed or subscribe, and you can look at my other videos if you enjoy that type of content. Honestly, I have been so impressed so far with the information sources that we have in Trinidad and Tobago. I think the press conference, the last one that we had, this video is being filmed on the 18th of March. So we have one carded for a few hours from now. But the last one that we had was very informative, and I think it was very well done and well thought out. And I think on the Ministry of Health's page, even on Facebook itself, they are doing a great job at getting the information out. I just have a particular problem with why the information about the new cases for the past 2 times has been released so late in the night. I don't know if the government feels that, like, when we wake up in the morning we'll forget, or if they talk about it late enough in the night it'll be a dream and we'll wake up and it doesn't exist or something. I don't know what it's about, but I think that the information is being released too late, and I think that not enough information is being released at that point in time. I think at the point in time that they let us know that there's a case, that they do have enough information to tell us more. Jamaica's correspondents, when they had their additional 6 cases, they were able to highlight where each person came from within the past 14 days, what countries they went to and from. And that information is important because you never know in a situation like this really if you were or were not in contact with somebody who has tested positive. Yes, I do understand patient confidentiality. However, the name of the patient will not give away whether you were, hey, yeah, I did go to that grocery store on that same day, or yes, I was on that flight that that person used to go from Tobago to Trinidad or something like that. It's not a very difficult thing to do. So I'm hoping in the next few hours when they have this press conference that they highlight these things. But you all will know, because you all in the future, I'm in the past, you all would know, and I would know at that point in time too. Oh yeah, also YouTube isn't monetizing a lot of videos that mention coronavirus. I think you can mention it casually now at this point in time, but if you mention it in a more informative way, even though you are a registered doctor and well researched and such, they won't monetize the video. Not that I do YouTube for money, but money is nice. So yeah, that's also why I can't really be going back to coronavirus even in my normal videos, and I'm gonna give little updates and stuff because they'll demonetize the entire video, and that's not necessary for me right now. So I'm gonna go about my normal life, doing what I have to do, social distancing as always, living my worst / best life simultaneously, again as always. But in terms of updates, you can always find me on social media at Kim Cudjoe, and you can ask me questions there and I'll adjust them privately. Also, this intro is so long. I usually do a meme type video called Things Only Trinis Can Relate To, where it's just memes taken from Twitter, Facebook. We have really funny Trinidad and Tobago specific coronavirus videos. We do, but me as a medical professional, I cannot be on record laughing at anything that has to do with COVID-19, and I would not be. I won't judge you for laughing at it. I have seen a few. I probably let out a chuckle here or there. I might share them sparingly, the ones that, you know, don't directly deal with morbidity and mortality, but at the end of the day I can't be making a video like that. So I mean, feel free to do that. However, just give me a little shout out, you know, for the idea. Finally, to this specific video, in this particular video, I will be addressing a few of the questions that some people have sent me. So in this video, I will be covering updates in Trinidad and Tobago thus far, what is meant by flattening the curve, should Carnival have been cancelled, the difference between isolation, quarantine and social distancing, my opinion on the global pandemic as a doctor, the wearing of gloves at grocery stores, and how to build your immunity against COVID-19. In Friday's video, I will be covering, should ibuprofen not be used in COVID-19 cases, does alcohol stop COVID-19, I mean drinking alcohol, does Trevor Sayers have the answer if the coronavirus can't survive in heat, black people can't get the coronavirus, homemade hand sanitizers, and mental health and COVID-19.
Coronavirus!
So we can get started with the updates. These are updates as of Wednesday the 18th of March 2020, the morning of. So currently we have 7 cases of coronavirus. We have 131 persons tested, 7 of those were positive, and they are said to be 7 imported cases. When we were aware of the 5 cases before last night, it was said that all of their contacts, all of their close contacts were in quarantine. Currently, I am not aware of if the close contacts of the other 2 were placed in quarantine as yet, and all of these patients are currently in facilities that facilitate isolation. So at this present point in time, there is no documented evidence of community transmission of the disease. Community transmission would be that the person actually came back to Trinidad and they passed on the disease to somebody that they interacted with while in Trinidad. So far, what updates have we gotten from our government? So cancel vacation is non-essential. Schools are closed until April 20th. Some arrangements are going to be made to get food to the students who rely on the school feeding program for meals during the normal school term. Pandemic leave is now a thing implemented by the Ministry of Labour, where they are taken into consideration that there are some parents that won't be able to attend work because they have to care for their children at home. Also, for people who have been in contact with persons who have contracted the coronavirus, they might need to be isolated or quarantined. And also, if it comes to a situation where there are people with the coronavirus who are not isolated in hospital but treated at home, it will accommodate for those who take care of persons at home as well. So the purpose of this is time out with no impact on gratuity or pensions, and even sick and casual leave, and no fallout from employees at a legal standpoint. Oh yeah, also if tested positive for COVID-19, persons will also have access to it, because yeah, that's obvious, right? There's currently no entry of non-citizens of Trinidad and Tobago into this country outside of special circumstances, and the special circumstances just involve people who are needed to actually deal with the cases of COVID-19. So outside of COVID-19 related circumstances, no non-nationals are allowed in the country. And again, as stated before, the nationals that are brought back into the country, the residents that are brought back into the country, are encouraged to self-quarantine. Currently, there are 75 citizens seeking return back into Trinidad and Tobago, and this will be facilitated. Amendment. This morning, 68 nationals returned to Trinidad and Tobago after being on a Caribbean cruise ship where there were some persons that were tested positive for COVID-19. So they were on this cruise ship, and then they were flown to Trinidad and Tobago at the Piaco International Airport, and they were quarantined since then. All of them were tested, and all tests for these persons are negative at this point in time. But as we do know, especially if you watch my old video, that the incubation period is usually 2 to 14 days, so it could be that they don't test positive. They have not tested positive as yet. All bars are closed. Congregations of more than 25 people are disencouraged. Common sense is to be used. Don't go to cinemas, don't go to restaurants. Restaurants are making accommodations for curbside pickup or takeout. Deferrals for payments of bank loans to be considered. Credit card interest and cost of rent to remain constant as a niceness, not as enforced law. Churches not allowed to congregate. Churches admonished for continuing to congregate despite previous warnings. Close to 300 beds are available for persons who have to be isolated. I'm not sure how many ICU beds there are, if they were able to open up any new ICU beds, but most likely no. My estimation of that would be about 20 ICU beds, which is arguably as important, and I think that an official statement by the Minister of Health should come out as to how many ICU beds we have available as well. Oh yeah, and our economy can't handle any of this. We will be out billions of dollars. Best case scenario.
Coronavirus!
So what is meant by flattening the curve? Minister Dial Singh in the last press conference introduced the public to a term or concept called flattening the curve, which is the reason for all of these changes. So it is based on this graph, where, as you can see, this is the number of cases here. This is over time, right? So as you can see from this graph, oh my god, I'm not a teacher. As you can see from this graph, the number of cases increase over time, and this is the line that shows the hospital capacity or the hospital's ability to take care of these people. You know, the number of beds, the number of available staff, number of equipment, and such and such. As we can see, as the number of cases increase rapidly over time, we exceed the healthcare system's capacity to deal with these cases. However, if we take measures early and we slow down and reduce the number of these cases, we flatten the curve. So the curve is no longer, you know, has a peak, it's a little more flat, right? And you can see it lies under the healthcare system's ability to handle these cases. So at no point in time is the healthcare system overwhelmed by the number of COVID-19 cases that we are getting. As in, we avoid overburdening a healthcare system that does not have the infrastructure, staff, personnel, or equipment to handle a sudden surge of thousands or even hundreds of new patients. So that's why we are told to practice social distancing. Unlike in Trinidad, where we have imported cases internationally, there is community transmission. There's about 2.5 persons infected per one person that is infected. The ones responsible for spreading the illness are not the ones who tend to end up in the hospital. They are the ones who feel well enough, so they go about a normal day and they gallivant all over the place. And because of the nature of this virus, they are so much more in number than the people who actually require hospitalization. That the people who require hospitalization, their numbers increase just because of those. So it ends up peaking like this. Without adequate hospital beds, we may reach the stage of Italy, where they had to pick and choose which patients to actually take care of and at what level to take care of each of these patients. And where patients who come in for non-COVID related accidents or incidents will not have access to care. This graph, as you can see, with this being roughly the same volume as this area here, doesn't mean that the total number of cases would go down or we would not get the same number of cases. We might get the same number of cases that we expect. We'll just get that number over a longer period of time, where there will be hospital beds available and staff would have equipment and necessary protection in order to prevent them from contracting the disease and themselves getting sick. And likely along those lines here, we might reach a point where there is a cure or a vaccine, and hence this gets cut off at a certain point. So in summary, stay in your house. People are finding it drastic that we are asked to stay away from public places, and the congregation limit is 10. After 10, it's penalization. So 10 is the congregation limit. We find this drastic. You can go to the cinema, you can go to the beach, you can go to the river. However, you need to take into consideration that in places like Italy and South Korea, their numbers raised from 1,000 to 5,000 in a matter of a couple of weeks. Imagine we have 300 beds available and we have the population to have an increase to 5,000. How will we accommodate all of our people? So yes, just stay in your house. And again, I spoke about this in my last video. Oh, it's just the old people being affected. My grandmother is 79 years old. She survived cancer as well as my grandfather, and I don't want anything to happen to her. So yeah, you be careful about that. The statistics is like 97% of people are fine, but only 3% might die. So I saw a tweet and it's like you know, if I give you 100 Skittles and I tell you that 3 of them will kill you and 97 of them are fine, will you eat the Skittles? And it's like, no. It's like, yeah, that's pretty much the statistics for the coronavirus. There are some people who are contracting the coronavirus, getting tested, and then they discover that they are immunocompromised in some way, or they do have a chronic medical condition, and that's unfavorable for them. So as immortal as you feel that you are not. And also, do you all like being sick? Because it's, if you could avoid getting sick, wouldn't you avoid getting sick? So yeah, just do what the common sense things that the government is asking for. Carnival should have been cancelled. People have been saying this so much, it's sounding like it's a soca. Carnival should have been cancelled. Carnival should have been cancelled. Carnival should have been cancelled. Everybody thinks that, and yet none of the cases that we have had that have tested positive so far were people who were here during Carnival. All of them came in well after Carnival passed, more than 14 days after Carnival passed. So obviously the coronavirus, COVID-19, was not here during Carnival time. I don't understand what is so hard for people to understand. COVID-19 was not here during Carnival time. We were so grateful to have Carnival go off without a hitch and have that money in our little piggy banks for the economy, because the rest of the islands, they don't have that. They don't have that, and they're looking to scramble through. Their Carnival cancelled. Their Carnival is cancelled, and we little goddess at Trini allowances and now is a problem. It's not a problem because all of our cases are imported. And in terms of the imported cases, people are making a point of saying that they are only finding imported cases because they're only testing people with symptoms and who have a history of travel. No, they're also testing people who have primary contacts with persons who have been tested positive as well. So if you have primary and secondary contacts with people who have been tested positive, primary contacts get tested automatically. Secondary contacts, as in people who they might have seen for a second or whatever, probably not touched, probably just been in the vicinity with, are being quarantined for the length of time and observed for the emergence of symptoms. If that is the case, then they would have picked up if there was community transmission at that point in time, most likely. Again, none of this stuff is foolproof. A lot of it is just we just doing stuff that makes sense and stuff that we noticed in other countries worked and did not work, and we are able to adapt it because it didn't come to us in the early stages, thankfully. So we're able to look at the other countries and look at what they do and assess the efficacy of it and adjust it for our setting.
Nobody touch me. No face, no bunks, no five. Hail me. If I don't hear you, go your way. Understand? Easy with the touch thing because it closed down. Coronavirus then service. Control your bowlers and them when you're talking, don't let it come for me. Don't cough, sneeze, now belch close to my ear space as I'm gonna box you in your face. Understand? Let's avoid corona and violence.
Right, the difference between isolation and quarantine and social distancing. I know the whole quarantine name is kind of more catchy, quarantine and chill. It just sounds, you know, better than social distancing. But what most of us doing is social distancing. Right, so I'll start with isolation. Isolation is the separation of ill persons from the persons who are healthy. We have the confirmed cases are currently in isolation. Quarantine is to separate and restrict the movements of well persons who may have been exposed to a communicable disease and may not be developing symptoms as yet. So these persons may have been exposed to COVID-19 but do not know it. For example, people returning from countries where there are a lot of cases. Or there is a possibility that they may have the disease but they do not show or are yet to show symptoms, such as relatives and friends of the people who are currently in isolation. Self-quarantine is when you do it yourself. Previously, there was no restriction that was legal that was placed, but there will be the Quarantine Act put in place where the persons will be strongly encouraged to stay in quarantine. So there'll be security and all of that jazz, also a fine of $6,000. Social distancing is what we all should be practicing now, which I've been doing for my entire life basically.
Nobody touch me. No face, no bunks, no five. Hail me. If I don't hear you, go your way.
So there are changes in behavior that will help prevent the transmission of the disease. So curtailing social contact, work, school, recreational activities among seemingly healthy persons. And we already explained how that works.
Coronavirus!
How do I feel as a doctor currently having to deal with a global pandemic? Honestly, I personally feel no ways about it. That's just because I'm in a peculiar position in my life where I am not employed with the hospital. Currently, there are hundreds of unemployed doctors in this country. They just asked for too many of us, and they allowed for too many of us to do medicine, and they graduated too many of us. I don't know what the problem is, but anyway, all of us are registered, all of us are certified medical professionals, but there aren't enough jobs for everybody. I'm very specific as to where I want to work, just because of where I live, and the fact, I could be wrong, just my personal thought that I was not put on this earth to suffer, so I should not accept any job that is less than what I'm qualified for. But if I was in the hospital, would I be concerned? Yeah, probably a lot more than this. Right now, I'm an average citizen, just like you and I. So as an average citizen, I don't think that you should be concerned. Yes, granted, the fact that I don't have a job to go to every day means that I can social distance myself in a better way than people who have to go to work, who may have to use public transportation to get to work. But I do have to take note that at the height, at the peak of H1N1, a lot of doctors and medical students did get H1N1 from the hospital. However, there weren't any real measures put in place to prevent that. So that's not a case like COVID-19. We can't look at that and say, okay, well, that's probably going to mirror what's going to happen with COVID-19. No, we can't look at that. But we need to consider that the chance of getting it, the chance of contracting it is high. Yes, we do have personal protective equipment, and we do have more personal protective equipment coming in, but it's something that we all would understand is a possibility of happening. And in certain places such as Italy, where their staff numbers have decreased to such little numbers, they are actually rush graduating medical students so that they would become doctors and be added to the workforce. So of course, if it is that they do need us, they will call on, as I said, registered certified doctors to come out and work, and at that point in time I will be prepared to work. This is what I signed up for. This is something that I love doing. I always say I wanted to help people, so if this is how God has determined that I help people, then this will just be it. But for now, COVID-19 will have to meet me in my house, if it meets me at all. And you know what strange thing is? People say God is a Trini. I don't think God is a Trini. However, my mother is a Trini. My mother always gets away at the end of it. You know, she might have a little struggle, but she always gets away at the end of it. She said if I was working, she would have been too concerned about me. So that's probably why the whole unemployment crisis amongst doctors happened for the past 2 years. And that seems that seems quite plausible. So never underestimate the power of your praying mother. Like, they can do miraculous things. I don't know.
Coronavirus!
Oh, you nasty.
What do you think about people wearing gloves in public places, example at the grocery stores? Gloves do prevent direct contact with the droplets that would carry the virus. However, they stick beautifully to gloves just because of the material in comparison to skin. So if you are wearing gloves and you do pick up the virus, SARS-CoV-2, from a surface, you and that virus gonna be like gang, 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 gang for a long time. And then you touch money and groceries, which will be present in people's house, in the kitchen, where they make things that they need to eat, and food goes in the mouth. Yeah, it's going to cause more problems than it's going to help. People need to understand that ideal use of gloves has to involve replacement or washing and disinfecting them as often as you would wash your bare hands. Otherwise, they won't be effective. Latex gloves are used for short use. When you go to the hospital, the doctors are not wearing gloves all day. We wear them for whatever procedure we need to do, and we take them off one time. They are not durable, they rip and they tear very easily. So the only thing that they provide is a false sense of security. So you think that you're safe by wearing the glove, but you're really not. What it really does is increase the demand for something that is necessary in the context of a hospital. And it is a limited resource. I guarantee you all touch your face way more than you're supposed to. Even thinking, okay, I shouldn't touch my face, you all are still touching your face, your brain just blocks it out. The average person touches their face about 23 times per hour. You really think you got that number from 23 times to 0 within the past week? No, it didn't happen. So you're touching your face, you're just forgetting. It's just standing up and looking at people, and I'm seeing them thinking and scratching the eye, and they're not thinking about it. But yeah, they will go home and say, I don't touch my face, I sanitize my hand. No, you're touching your face, you just didn't realize that you touch your face. And in the same way, you're going to be touching your phone. My phone shows how many times I unlock it. I unlock my phone compulsively for absolutely no reason during the day. So you touch your phone more often. You check it when you're looking to check the time. You can have a fully functional watch in your hand, you'll still check your phone. So what do you prefer to touch your face and your phone with? A glove that you had on for the entire day, or your newly sanitized hand? Plus, please don't forget that bacteria still exists. Yes, COVID-19 winning, but bacteria still exists. So wearing your dirty, grimy gloves and touching several things, including people's food, could actually permit the spread of bacteria. But at least we know if you'll get gastro, you'll buy enough toilet paper to accommodate for that. So at least we're safe there. I actually think the Prime Minister or the Minister of Health should come out and say that these things, the science does not back up that these things work, and instead have sanitization stations for employees. But he won't, so it's up to us to be wise about it. I know some places are forcing employees to wear them as well. You can show them the studies, or you can also forward them this video if you want. But if you are forced to wear it, remember to sanitize your hands immediately after removing it, and also before you put them on. Beware of rips. You need to change them very, very often, so also ask for a large supply of them. And don't touch your face. And all of this, it also goes with the surgical masks. Unless you're sick and you lie down in Cora, don't wear a surgical mask, that's all. Or unless you're a surgeon.
Coronavirus!
How to build your immunity against COVID-19. We as a public are obsessed with the possibility of building our immunity. I think it's because we finally have something in our own hands. Everything with our body, we don't choose it. We don't get to choose what type of hair we have. We don't get to choose our skin tone, how big we nose is, how big we bumsy is, and all of those things tend to matter with how we traverse through life. But immunity, Yeah, you can fix that, man. When it comes to immunity and building immunity, a lot of it was not real. A lot of it was stated how it is stated in order to sell product. So products like supplements or products like vitamins and minerals, etc. All pseudoscience has practical elements of science that have been misunderstood or misconstrued. Vitamins such as A, C, and D, and minerals such as zinc do play an important part in our immunity. But there are also practically unavoidable components in our diets present in fruits, vegetables, and meats in large quantities. And giving you more of them won't help. The only thing that so far seems to have a bit of reasonable evidence to it is zinc in preventing colds in children. Alright, vitamin C. Everybody rushes for vitamin C during the cold season, whether it's Redoxon or you're just sucking down a set of orange. Orange is so expensive though. Like, I mean, I think I pointed out, did I used to have orange trees? I never remember buying oranges in my life. I think I never bought oranges in my life. I'm still getting it free. People who buy oranges, y'all okay? Your bank account's okay? Because, whoosh, it's so expensive. Anyway, vitamin C in the body is not created in the body, so it has to be taken from an external source. It is used in building bones, muscles, and other tissues. It also assists in the formation of collagen and helps the body to absorb iron. Overall, experts have found no additional benefits of vitamin C for prevention and treatment of the cold or the flu. And of course, since COVID-19 is brand new, nobody has done any studies about what vitamin C is going to do to COVID-19. In terms of the cold, some studies show that there may be a benefit, usually in the shortening the duration of the length of the cold itself, but that required doses of 8,000 milligrams per day. At doses of over 400 milligrams, vitamin C is excreted in the urine, and dosages of over 2,000 milligrams or more can cause diarrhea, abdominal pain, vomiting, and nausea. So, I am not a believer in drinking ginger and what else you always drink? All that stuff, neem, and all these teas and stuff in order to build your immunity. Not saying that you shouldn't do it, because these things cause no harm, so might as well just continue doing it. Just know that don't get a false sense of security thinking that you're protecting yourself, or don't get a superiority complex opposite people who don't do stuff like that, because it's not going to do anything to you medically. It might do something to you mentally, which is also important. Things that you can do to enhance and maintain immunity are things that you must do. The only good things that you must be doing all the time consistently, such as good diet, exercise, avoiding stress, personal hygiene. And they only impact immunity because they impact overall health. They impact skin health and eye health and gastrointestinal health as well. We need to stop looking at getting ill as our immune system feeling, even though it's exactly that. We need to stop looking at it like that. Fact of the matter is, if a pathogen wanted to invade into your body, it is so fully optimized for invasion, because that is their only purpose on earth. A virus is not even alive, and yet it's so specific to invade mucous membranes. And the fact that the coronavirus is called the coronavirus because it has the crown-like shapes on it, which acts as factors for adhesion to mucous membranes, and the mucous membranes are lining our respiratory passages, and that's how they get. Everything is so optimized for harming us. It's really not your fault if you get sick a lot of the times. So a lot of the times, once the pathogen gets inside of you, it's above me now. However, while I was getting my education, I would always say I would never let education make me stupid. I know that a lot of these things are never going to be tested because of Big Pharma, because there are large organizations that make a lot of money from us depending on medications that come from the pharmacy and not from our backyards. I understand that. And also symptomatically, yes, there are a lot of things that I do admit would work. Like, let's say if you have an upset stomach and you have some garlic tea or some ginger tea, it helps to settle the stomach. If you have fever, people would not still continue drinking fever grass after all these years if it didn't work to some extent for some people. I had a sore throat that was not going for anything, and I despise sore throats. I hate sore throats because I can't have mint, so I could never get relief for a sore throat. I had some pecan puncheon. Yeah, it nearly killed me, but it make me live. It prolonged my life because my sore throat went. And yeah, that's technically bush medication, but it worked. So yeah, there are a lot of things. I would never come here and say, okay, don't do your things, don't implement your things that you learned from your grandmother, because I feel I'm smarter than she. I'm not smarter than the grandmother. I am more educated than the grandmother, and there's two completely different things. So yeah, just take these things with a pinch of salt and understand that, okay, it's not a foolproof method. If it is that you're doing it and you're accustomed to it, continue doing it, but make sure, and whatever healthy habits you have, make sure it's long term. Well, that's it for today. Thank you so much for watching this video. If you have anything that you want to add, you can always comment down below. I try to reply to every single one of my comments. If you enjoyed this video, make sure and click like down below. You can also share this video if you would like to get more information out. Also, you can follow me on social media at Kim Cudjoe, Twitter, Instagram, and Facebook. As I said, I'm doing these videos for free and they're very painful and time consuming because I have to keep up with every single relevant piece of information available to me, and it's very frustrating. I'm very stressed out. So I would appreciate if you enjoy this video that you subscribe and you share to others, and I'll see you in the next video, which will be on Friday. And always remember, wash your hands and
You can wash your bottom.
bye.
Oh yeah, oh yeah, oh yeah. Love so long, love so strong. When I look into your eyes, all the stars align. She on a different vibe, a different high. Got to make a mind, so I stepped